Welcome to the Integrative Shift, reimagining the future of medicine with pioneers in the field. In this series, we explore doctors' journeys from allopathic medicine to integrative medicine and how it benefits their practice, their patients, and themselves. Today, we have the privilege of having an interview with Dr. Janine Kirby from the Eastern Cape. And she's a medical doctor and also a qualified homeopath. Welcome, Janine.
Hi, thank you for having me, Alma.
I'm so excited to chat to you today, and we would love to hear your story, basically, about your transition, how you managed to evolve from pure allopathic medicine into integrative medicine. If you perhaps want to take us back to when you first qualified as a medical doctor and how you were thinking at the time and how you managed to work yourself into more holistic medicine.
Yeah, thanks for the question, Alma. And I think I like that idea of it being a transition, so that it's not something that happens quickly or immediately, but that it's a way in which we evolve and we just start thinking in different ways. And what I noticed in integrative medicine wasn't actually so much the acquisition of new knowledge, but actually how to integrate that new knowledge in the allopathic model that I had been trained in. So to go back to that allopathic model is I was at UCT and after I graduated, I had a real sense that my path was to be working in family medicine with underprivileged communities. And so I came back to the Eastern Cape and I studied my master's in family medicine. And during that time, actually gained a lot of knowledge about myself and about community settings, about medicine, and this lovely interplay between the three. And I then started working in a clinic here in East London and really felt that that was my calling. But in that time while I was working here, I completely burnt out. I think that a time of burnout is always, or a time of any time that's stressful, is a time when we have the possibility of introspection and reflection. And I realized that a lot of what was sapping my energy was patients coming to me with ailments which were actually not physical ailments per se. They were just physical manifestations of underlying stresses, like poverty, people living in crowded circumstances, people with the burden of addiction, HIV/AIDS. HIV was just at that stage coming onto the scene when I was still working in the public sector. And this question that patients were asking was, or asking me to do for them, was to make them better. And I didn't feel as if I had the tools or a toolkit that I could call upon to actually be able to do that for the patients. It just felt that all I was doing was giving them medication to suppress the symptoms. And we weren't really looking at why the symptoms were there and ways in which the patients could be present and could find ways in which they could cope with what was happening in their lives, ways to increase their strength, their inner strength and resilience. And, it actually, I just couldn't work in the system anymore. I became quite unwell. I went to an international family medicine congress and got the worst headache I ever had in my whole life. And I realized that I actually needed to be listening in to my own body and that I needed to go on a different journey and to find another path. And it wasn't a path that anybody else I knew was going on. But I knew that if I stayed where I was just going to become very, very ill. And so
So you turned a crisis into an opportunity.
I did. Well, yeah. I mean, I think that I'm really grateful that I had the support of my family and my husband, because I think lots of people can't see their way out of doing something different. And whereas I just couldn't see my way of staying in that space. And then why homeopathy is actually, is a strange question. I started reading a lot of books. At that stage, it was before really there was a lot available on YouTube, or that the internet wasn't the wonderful resource that it is now. And I read a book on all the different complementary therapies, and there was one on homeopathy, and I thought, oh, that's just rubbish. I'm not going to read it. And at the end of the book, I thought, no, let me just do this to completion to do it correctly. And so I read the chapter on homeopathy, and all I can say, it's just one of those moments, I think we all have them, when we intuitively know something. And it's very hard to say what it is or why it is, but it was just this intuitive moment that I closed the book. I turned to my husband and said, I'm going to study homeopathy. And I could see him looked at me with eye rolling, like, oh, there she goes again. But I didn't know how or what. I just knew that was the next part of my journey. And fortunately, at that stage, there was a course available in South Africa, and I traveled once a month, first to Cape Town for my first year, and then thereafter um, to Joburg for lectures, and then qualified in homeopathy. And
Wow.
left the public sector and started my own integrated practice.
So it was indeed homeopathy really that opened your mind to a more holistic view on things, because homeopathy is so holistic, isn't it?
Yeah, I think I was already thinking holistically. I'd done some stuff with Reiki, and I'd done some, a lot of other reading. And so it was just also looking at this idea of illness being symbolic. And yet again, nothing that had ever been taught before, but something which I intuitively knew. So that when patients came to me and they had pain in their chests, they all had heartache. They all had, um, something that was related to somebody very close, usually children. And
Yeah.
that was the
Big
reason why they were
fan.
experiencing that pain. And it was very typical. And so there was this thing, like I was thinking, I'm seeing this stuff, I'm noticing this stuff, but there was nothing I could hang it on. And so that when I started exploring these other modalities, it came as such a relief that it wasn't just me, and that there were all these other systems of medicine and systems of thinking out there that really made so much sense in the light of my experience and what I was seeing with patients.
It's amazing. So it sounds to me as if your frustrations in the public sector also had to do with the fact that you were not really empowering people, which is what you wanted to do. And by
Exactly.
not empowering your patients, you were also disempowering yourself and got yourself into a real hole about that, which makes sense. And it sounds as if homeopathy is what connected you to like the bigger energy that now makes sense in your deepest levels of yourself, which means your energy is well spent and really helping people.
Mm.
So we would say that your turning point really was the crisis, and then the journey is facilitated a lot with homeopathy. And so, what other modalities do you use today?
Well, I mean, the other thing which I spend a lot of my energy on, and increasingly so, is on mindfulness. And yet again, that felt like quite an intuitive moment. A very close colleague of mine, who's a psychiatrist, had just done the very first mindfulness course that was run in Cape Town, and he came down to visit me in East London and told me about it, and I just knew that that was another part of my journey. And And I just got a sense, our journeys and our lives are so short that actually, when something comes up that feels like the space that we need to explore, is I just explore it and I move towards it. And so yet again, I just thought, oh, I'll have to do something with mindfulness. And then I was visiting a patient at home, which I never do, I never used to do. And I heard somebody on the radio who was a mindfulness teacher in Port Elizabeth, and then contacted her afterwards, and she came through and taught us mindfulness. And um, myself and a fellow colleague who's a psychologist, we actually then trained and we taught mindfulness programs for over 10 years. And I'm now the national chairperson for the Institute for Mindfulness, and I sit on two international bodies as well, of international associations of mindfulness, and also I sit on a body for all those who are kind of leaders in mindfulness internationally.
Wow. And so you also teach particularly doctors to use mindfulness in medicine?
Yeah, so one of my passions that goes alongside this, and it maybe comes out from my own story of burnout, was ways in which we as medical practitioners can look after ourselves in very difficult and stressful circumstances, and ways in which we can learn to A, recognize what's happening, and then B, ways in which we can learn to regulate and learn to center ourselves and learn to be kind to ourselves in the midst of what is happening. So yes, I do that as well.
So the very demanding careers we find across society, but very much in medicine also, particularly since maybe the COVID days, that the self-care aspect has become a very big conversation. And the mindfulness for me fits very nicely into that, doesn't it?
Mm. I'm sort of sometimes worried about this concept of self-care, because in some communities it's taken to being all about me. It's kind of as there's sometimes a narcissistic component that feels like it's crept in. It's like I deserve this and I deserve the
Yes.
best.
Yeah,
Um, Rather than the sense of being able to regulate, be in community with other people, share our stories, um, and recognize this is a very hard space. And what do I need to do that is going to be kind and wise in order to be able to be present in this space?
absolutely. But also kind to yourself. So it's kind of the balance, isn't it?
Yes, yes.
Between
I think
inner
I
care
prefer
and
that.
outer care.
Sorry, I think I prefer the idea of self-kindness or self-compassion to
Yeah.
self-care, simply
For me,
because
kindness
of
is
the way
always
it's.
the word.
Yes,
It
yes.
encapsulates it nicely. I mean, kindness is never going to include selfishness. They just
Yeah.
don't work together. So
Yeah.
that is such a good word to use instead of, yeah, I understand where you're coming from with the excessive focus on me and myself,
Mm,
which I have to say I I don't see in the integrative space. I
mm,
find our members very balanced and caring, and obviously you need to remain standing yourself, so you need to take care of yourself as well. But I think that is what for me is so exciting about the integrative space. It's not just about the patient. The doctor also has to be good with themselves to be able to care properly for others. And you can only really teach by example as well. And so it sounds to me like it speaks to this concept of it takes a village. Yeah, it takes you and your patient. Everybody works together for the good of the patient, isn't it?
mm. I mean, I think you are touching on a very essential aspect for me in integrative medicine. So I think that in allopathic medicine, is what we have is patients present us with a symptom. And then what we do is we suppress it and use words like we're going to fight this or we're going to win, or there's like these words about how to suppress, and we use very strong suppressants
Yeah.
and antis. Whereas in the whole sort of mindfulness integrative space is that it is more looking at exactly what it is and really understanding the exactness of what it is. And then asking the questions of what is this need that's going to be kind and wise, which is, uh, John Kabat-Zinn, who started the whole kind of mindfulness movement in the West. He calls it an orthogonal shift. In other words, it's like a 180 degree. Instead of
Yeah.
this idea of pushing away, it's this idea of turning towards with kindness and wisdom.
It's again the word integrate. So
Yes,
your symptom isn't something to fight. So we don't use the war mentality, which is exactly
correct.
what is
Yes.
worldwide unfolding too much now. But it's
Mm,
embracing and listening at a deeper level to your body, which is exactly what delineates your journey. Because every time you made a shift is when you listened inside. I call it
mm,
obedience to the inner voice, and that
mm,
always took you into the right directions.
mm. Yes, yes.
And
I
I think
mean,
often in allopathic medicine, the opposite is encouraged. It's not, don't be silly. We know what it is, whereas the inner voice is also important.
mm. Yeah, and in allopathic medicine, it is actually, there's this idea of us being kind of perfect and never getting anything wrong and never making a mistake and, not showing too much emotion and kind of being these warriors that are out there to fight this illness. And there's this sort of picture of a doctor that's quite different from the picture that I have now. Yeah,
And it also could be a huge burden on the doctor as well, I can imagine, if you
it's
have
a
all the
huge
power.
burden.
As
It's a
opposed to, I think, in integrative medicine, it's spread. The patient's responsibility also comes to play. It's also about your lifestyle and what you're doing and what you're consuming, etc.
yeah, it's definitely collaborative. Whereas, in allopathic medicine, it's much more like I need to keep control and hold on to this and make sure that everything is under control. And it's my
Yeah,
responsibility to. And of course, there are moments when that is true and where
yeah,
allopathic medicine is very good. And
yeah,
so I think that's the thing about integrative medical doctors is that it's not that we don't use allopathic medicine, because of course we do. And definitely, I mean, in acute and severe life-threatening situations,
yeah,
when need an appendectomy, I'm not going to give you some homeopathic remedy.
yeah.
So there definitely are moments at which, we need to be wise and to practice discernment and to understand also what the patient is asking us for. But I think it's more that we don't use allopathic medicine. It's just that we have got more in our toolkit. We can call on more resources. We can call on more ways of seeing things.
Exactly. So we don't replace one thing with the other. We don't throw the baby out with the bathwater. We just have more tools, wider scope, deeper insight, possibly, and in a sense, also more compassion, more humility in the process so that it's a team approach and it's worked out together.
Yeah, I mean, it's not to say every allopathic doctor isn't kind or humble. I think that's
Yeah,
also, an inaccurate depiction, or that every integrative doctor isn't.
example. Yeah.
Yeah, but I think we're making just broad generalizations. Yeah, yeah.
Yeah, I'm just talking, yeah, in general, I find often in allopathic medicine, you are not allowed to know things, and some doctors don't like you quoting stuff from the internet or things, books that you have read and whatever else. which ends up as a gaslight and disempowering you as a patient, or you feeling unheard. And I think the whole being heard aspect in integrative medicine is the is half of the cure already. Just because people are listening, our doctors take more time. It's not 15 minutes in and out, and it's not a sausage machine. And I think a lot of illness, don't you think, plays into is caused by stress and isolation and not actually having a voice of your own.
And it's not just integrative medicine. We learned that in family medicine is one of our basic trainings.
Yeah,
And that in family medicine, when you just ask the question from the patient is like, why are you here? What you worried about? How can I help you?
yeah,
Um, is that when the patient is feeling heard and is being able to express what they're worried about, is that we notice that it's like 70 or 80% of them as they leave the consulting room already feel better,
yeah.
which is not true then if we've had a consultation which isn't patient-centered. Yeah.
And if there isn't enough time, I mean, you can't do that in 10 minutes, hey? So it also speaks to the
Yeah.
fact that there's a time limitation, and we try to open up the time a little bit, which of course, speaks to the cost as well, which is where we need to get our balance sometimes.
Yeah, I mean, just to go back to that a bit, when I was working in the public sector, I'd have patients coming back to me every month or two with high blood pressure, and then just get the sense that I'm sorting nothing out. And actually, patients coming back recurrently was a waste of time. And
Yeah,
that for me to spend an hour with somebody and to just really get to the bottom of it and everybody to understand it in the end felt like that was actually time effective.
yes.
Um, and that actually, otherwise, I think that that felt like a waste of a resource, just repeating medication.
Same stuff, same old, same old. I
Yeah.
wonder whether you perhaps, per illustration, have one or two case histories that you might like to share where it illustrates how the broader approach manages to solve maybe long-standing issues.
Yeah, thanks, Elma. I was thinking about this and thinking actually, I suppose this is often what happens with all of us is that it's my own particular illness that made me realize how important a broader approach was. So I've got an autoimmune disease, ankylosing spondylitis, and when I was in my 20s and in my 30s, I was actually really very disabled by it. And so when I had small children, in the morning, really struggled with a lot of pain in my joints and a lot of stiffness. I couldn't even use my fingers. Um, and then particularly like pain in my right hip that would actually wake me up all night and I couldn't even walk short distances. Um, and I then I actually stopped eating gluten. And afterwards, I've actually become vegan. And that with that, just being on a very low inflammatory diet or an anti-inflammatory diet, how that actually completely resolved everything that I was feeling, together with a regular mindfulness practice and homeopathic remedies. But that I realized, as you were saying, that this is also about the patient's journey. And if the patients aren't able to do that or come along in the journey, often it is a sense like the doctor must do it for me instead of actually doing it for yourself. I mean, I think that my intention is for all my patients not to need me anymore, is actually for them to be able to become empowered in themselves, to understand their illnesses in themselves, and to understand how to look after it and care for it themselves. Um, and I was thinking then, how the opposite of that so often does happen, where homeopathy, we say we have the teeth patients, tried everything else, try homeopathy. And so the patients come to us, and a lot of the time, by the time a patient comes to me, their illness is already pretty organized, and there's a lot of secondary gain they're getting from it. So I was thinking, for example, I had a patient who had lots of bladder problems. She was literally pissed off with her husband, who used to sit outside. They couldn't stand each other. And her illness and her recurrent urinary tract infections, I think, was a reason that she could come and see me in a way for her to get back at her husband. And she didn't want to get better. She had no reason to get better because there was much too much secondary gain that she got from the illness. And so I think we need to really be aware of that and to recognize we do what we can do, but that we're not going to be able to look after everybody.
So in integrative care, how would you deal with such an obstacle? Would you send that person, recommend some therapy or coaching or something like that?
Do you know, I mean, I think that you always look at it, but I think then that comes to a place of wisdom and discernment. And sometimes when things are so organized and they feel that they're set in concrete, then I think it felt like it was my job then to rather care for her in that space. Um, and so I think there is sometimes a time for us to see like how much movement is there here, how much, will the psychologist help, how much will other modalities help. And sometimes it's just to recognize actually she's completely decided this is where she's going to be. And she just wants to stay in the space of chronic pain and can't actually see her way out of it.
Oh, that's very sad.
Yeah. And I think the other pitfall we sometimes have is actually with the worried well. Like I'm sometimes quite aware of people who sort of integrative doctor hop from one to the other and try a bit of this and try a bit of that and spend a lot of money on a lot of different modalities instead of just being quiet and being present and checking in on ourselves. So I think that that's another shadow that sometimes happens and is sometimes also seen as a space that only those who've got lots of money and those who can afford it can be in. And I think that there's places and spaces which, as integrative doctors, we need to ask is like, how can we best serve our communities in wider and broader ways rather than just on individual one-on-one patients who are often, are often actually fine, but are wanting little tweaks here and there. Yeah.
So I so appreciate your sort of social conscience. So you're saying be getting involved in broader communities
Yeah,
in
I
terms
mean,
of maybe in terms of a bit of health education and support like that.
yeah, I mean, I suppose I am in the mindfulness space, and in the mindfulness space, we're really asking these questions about not just running courses for people who are wealthy,
Yeah.
but actually, how do we translate it so that we can actually also be running courses around regulation and mindfulness in those who are working in NPO status, NPOs, or in in schools or in hospitals. How can we actually just somehow reduce the temperature in communities where there is so much trauma, and what ways can we as integrative practitioners also be making some difference in like in diet when people really have poor diets, as opposed to the tweaking that we do with the kind of wealthy people. um, I think that those are bigger questions, which I think we should also be asking.
Then also proper feeding for people who really don't have money for all sorts of fancy things.
Correct.
Basic healthy feeding, I think there's such a demand for that in this country.
Yeah, just put some basic health education around it. And you know, I also work in palliative care. And I was just horrified to see what had been donated to our local hospice, which was this like very pink so-called, I don't know, I say so-called, it was some kind of milkshakey something or other, which is just full of preservatives and colorants. And I just like said, guys, we have to give it back. We can't actually go around promoting stuff like this. Um,
Yes.
yeah,
So the responsibility in every day in where we move around as well. That's a lovely network approach that I really appreciate about you.
yeah.
Um, how do you see the future of integrative medicine in South Africa?
Do you know, I think all of us are kind of negotiating and battling with and trying to make sense of AI and what it's going to mean. And I think what has happened a lot with AI is we've got a lot of information, but with that, losing connection and losing
Yeah.
wisdom and discernment. And so I think that integrative medicine has got a unique role to play in integrating, trying to make sense of all of this information that's out there, and at the same time, forming very deep connections with other people. And that feels very um, opposite to kind of what's happening in the world at present.
So connection is under threat at the moment.
Yes. Well, personal
And
connection. I think you feel as if you
personal.
have a
Yeah.
connection if you maybe are having a relationship with ChatGPT, as I hear lots of people have, or
Yes.
on
Talk about
social
real
media.
connection now.
But like real connection with friends and with people, I think that's what we're going to be having to focus on. And I think that's that space of people being able to come in and tell their stories, and for the stories to be really deeply heard and to be really felt as if someone has listened to you and is going to walk alongside you on your path of healing. I think there's going to be more need for that.
So it's also the honoring of each other's pain, which is inevitable in this life, isn't it?
It's inevitable in this life.
Yeah. So one can't always cure it or kill it or something. Sometimes it just needs to be held by another person who can listen, who can hear you deeply.
Yes, and how much of a difference that makes to your experience of what it is, you know? I mean, we know this that people who've gone through severe trauma is that the single factor which determines how well you are able to cope with it is whether you had to do it alone or whether there was somebody there with you. Yeah,
And I think this is a beautiful note on which to close, because it speaks to the humanity behind what we do and the compassion. And so I thank you very much for chatting to us today. Thanks
it's
a
a
lot,
pleasure.
Janine.
Thanks, Alma.
Okay, bye bye.
Bye.